Infection control. Good infection prevention and control is essential to ensure that people who use care services receive safe and effective care. Effective prevention and control of infection should be part of everyday practice, and everyone has a responsibility in this area. What is infection? Infection is caused by pathogens, which are any living particle, animal or plant, capable of causing disease. Bacteria and viruses are both pathogens. They're microorganisms, which means they are both too small to be seen by the naked eye, and although they have different structures and different needs to survive, they can both cause disease if given the right circumstances. Infection occurs when an organism gains entry to a host, the body, and causes damage. The damage can be systemic or local. Systemic infection affects the whole body and would include symptoms such as temperature and pain, whereas localized infection would be redness, swelling, or pus around a particular area. Infection control is concerned with preventing infection. It addresses factors related to the spread of infections within the care setting. This can be service user to service user, staff to service users to staff, and among the staff. Preventative measures such as hand hygiene, cleaning, disinfection, sterilization, vaccination and monitoring are used to minimize the spread of infection. People receiving a care service are very vulnerable to infection. When people are sharing eating and living accommodation, infection can spread rapidly. Some infections can be very serious and in some cases life-threatening. If a service user has a serious medical condition or is frail, an infection can be extremely dangerous. Everyone within the care environment should be taking all possible steps to prevent infection in the first place. However, if infection does occur, procedures must be followed to manage and control the spread in order to protect service users, carers, visitors and staff. Recognizing an outbreak of infection. You need to be aware of the signs of infection, especially in elderly people, and know how to report this immediately in order to prevent further spread. Some of the signs could be fever, diarrhea, vomiting or confusion. An outbreak can be defined as 2 or more cases of infection occurring around the same time in service users and/or their carers, or an increase in the number of cases normally observed. A variety of people must be notified about an outbreak of an infection. All staff, including agency and other contractors, for example hairdresser or chiropodist, the GPs of those service users with symptoms of infection, the local health protection unit for advice, the environmental health department for suspected food-related outbreaks, and the service user's family and visitors. The manager of the care setting may decide to take particular actions to immediately minimize the spread of the infection. Some examples of this could be: reinforce hand hygiene notices and practices for service users, staff and visitors, enhance cleaning schedules, exclusion of affected staff from the work setting, closure to new admissions, further advice for staff on control measures to be taken, restrict visitors, cancel visits from external contractors. Keeping records. Documentation should be kept which will record the type of infection and how it was managed. There should also be information available for staff, service users' families, and other visitors. This should be in a language they can understand, so that everyone is aware of the situation and the reasons for the control measures being in place. A record should be kept with the following information on service users with suspected and confirmed infections: name, age, and sex of the service user, general practitioner's name, date of onset of symptoms, type of symptoms, Sample sent and results, if known. Diagnosis. Whether the case was notified or reported. If so, date of notification or reporting. Visitors to care settings can bring infection with them. In many acute settings, there are rules about hygiene that visitors must follow, and these are monitored by the care staff. Notices and posters can raise the awareness levels of people coming into the care environment. Many care settings will have a policy on gifts which can be brought in, with some establishments prohibiting food and flowers. Visitors who have symptoms of an infection should not visit vulnerable service users, as the infection can be quickly spread. It is always good practice for visitors to either wash their hands or use alcohol rub before and after a visit. Risk assessment. Risk assessment is an examination of what could cause harm to the service users in an individual care setting, and includes the risk of infection. By assessing the risk for each individual, measures can be put in place to control the risks. The Health and Safety Executives state that a risk assessment has 5 stages. Step 1. Look for the hazards. Step 2. Decide who might be harmed and how. Step 3. Evaluate the risks and decide whether existing precautions are adequate, or whether more work needs to be done. Step 4. Record the findings. Step 5. Review the assessment and revise if necessary. Identify the hazards. A hazard is anything that may cause harm, and listed below are examples in the context of a care setting. Direct physical contact with service users who are infected. Procedures which involve piercing the skin. Dealing with biological spillages. Dangers from sharps. Dealing with human waste. Direct contact with equipment and materials. Decide who might be harmed and how. Now that hazards have been identified, it is necessary to determine who might be harmed and how. It's important to include all groups of people who may be at risk, for example, ancillary staff, gardeners and visitors. By identifying all the groups at risk, it will be easier to assess the risk and take further steps to minimize this. Evaluate the risks and decide on precautions. The risk is the chance, high or low, that somebody could be harmed by these and other hazards, together with an indication of how serious the harm could be. The law requires the organisation to do everything reasonably practicable to protect people from harm. It's often not possible to get rid of the hazard completely, but it is often possible to reduce the risk considerably. Record your findings and implement them. Risk assessment should be written down and shared with everyone involved. Review your risk assessment and update if necessary. Risk assessments should be continually reviewed and updated. There are sure to be changes in the workplace which will require new risk assessments, for example, new equipment. As a care worker, you should be continually assessing the risk to yourself and the service user and make sure that you follow best practice and the organisation's policies and procedures. Legislation and guidelines. Infection is a complex issue and can occur in many different circumstances. Therefore, there are several laws, regulations and guidelines which relate to prevention and control. Details of these can be found in Handout 1. Chain of infection. In order for an infection to occur, there needs to be certain conditions as outlined below. As a care worker, you need to understand how the chain of infection works in order to protect the service user and yourself. Microorganisms. We all have microorganisms living in and on our bodies, and these are normal flora. They can be found in such areas of the body as the mouth, nose, or intestinal tract. Normal body flora is known as resident and seldom causes infection, except possibly from invasive procedures such as surgery or intravenous lines. Hand washing will not entirely remove these organisms, but will reduce their numbers. The other type of flora found in and on the human body is known as transient. This is the type of organism which can be passed from person to person, either by physical contact or by environmental factors. These do not live permanently on the skin and can be removed by thorough hand hygiene. This type of organism can cause infection. Reservoir. This is the place where the organism can thrive and grow. These reservoirs can be the environment, equipment, people and animals. Some examples might be a person with salmonella, or a piece of contaminated equipment, or personal effects of someone with an infection. Point of entry. The means by which the organism gains entry into the body. For example, this could be achieved by microorganisms entering through the nose, mouth and bloodstream. Point of exit. Microorganisms need an exit point. For example, Salmonella bacteria are excreted through feces. Mode of transmission. How the organism is moved from one place to another. All microorganisms need a method of transmission. One of the most common modes is by hand. Our hands come into contact with many possible infectious agents, for example body excretions and secretions. If hand hygiene is not rigorously applied, it is all too easy to transmit microorganisms from one person to another. Microorganisms can also be spread by droplets in the air caused by coughing and sneezing. This method of transmission is responsible for the spread of the common cold and flu. Other methods of transmission could be from food, water, blood, body fluids, insects and parasites. Susceptible host. This is the person who is not able to resist the organism's entry. This person could be at risk for a variety of reasons or circumstances which are lowering their ability to fight off attack. Extreme old age, poor nutrition, hygiene, chronic conditions such as diabetes and cancer, chemotherapy, invasive procedures, immune system status, limited mobility, incontinence, poor general health. Standard infection control precautions. Everyone involved in providing care should know about the standard principles of infection prevention and control and be trained in good hand hygiene, the use of personal protective equipment, and the safe use and disposal of sharps. Hand hygiene. Hand washing is probably the most important procedure in the fight against infection. You need to wash your hands frequently throughout the day, whether gloves are used or not, and remember to wash your hands on removal of gloves. You should wash your hands at the beginning and end of each shift, before and after service user contact, and whenever you are in contact with bodily fluids, such as changing dressings or assisting with bathing and toileting. You are expected to wash your hands before and after handling food and after using the toilet. It is very easy to miss specific parts of the hands unless a particular method is followed. The 6-step method outlined in Handout 2 is generally accepted best practice. However, before actually starting to wash your hands, you should look carefully at what you need to do. Remove all jewellery and watches. No nail varnish or artificial nails. Nails should be short and clean. Sleeves of clothing should be kept away from your hands. Cover any cuts or abrasions with waterproof dressings. Report any signs of soreness or dermatitis. Alcohol rubs can be used when washing facilities are not available. However, these should only be used on hands that are visibly clean. They are not suitable for use on contaminated or soiled hands, or during outbreaks of diarrheal illness such as norovirus or Clostridium difficile. Soap and water are necessary in these situations. Personal protective equipment. Personal protective equipment is used to protect both the care worker and service user from risks of cross-infection. In some situations, it will also be worn to protect against contact with hazardous chemicals and other substances hazardous to health. The equipment selected for the care worker should be based on a risk assessment, which examines the risk of transmission of infection to the service user and the risk of contamination of a care worker's clothing from blood, body fluids, secretions and excretions. PPE includes gloves, aprons, masks, goggles or visors. In surgical situations, it will also include hats and footwear. Gloves must be worn whenever there is likely to be contact with blood, body fluids, mucous membrane or broken skin. They should also be worn when dealing with contaminated items such as bedpans, drainage bags or dressings. You should be aware that some gloves are made of latex, and there are people who have latex allergies. There are several types of gloves available, and you should refer to your organization's policy on which are to be used. Rigorous hand hygiene is still necessary even if wearing gloves. Hands should be washed before gloves are put on and again after gloves have to be taken off. They must then be discarded. Gloves reduce the risk of contamination but do not eliminate it, so are not a substitute for hand hygiene. Disposable aprons. These should be worn whenever there is a risk of contaminating clothing. This contamination could occur by contact with blood, bodily fluids, equipment or a service user who has a known infection. These aprons must be discarded and disposed of when the task is complete. Remember then to wash and dry your hands. Face masks and eye protection. These should be worn when there is a risk of body fluids or substances splashing into the face, mouth or eyes. Masks are also a protection against infections which are spread in the air, such as tuberculosis. Safe handling and disposal of sharps. You should receive training in the safe handling and disposal of sharps. The following guidelines will help you. Dispose of sharps into an appropriate container, which conforms to safety standards, immediately after it is used. Do not carry them to another place for disposal. Do not attempt to put a needle back into its sheath. Do not overfill sharps containers. Lock the sharps container when ready for final disposal. Do not dispose of sharps with other clinical waste. Do not put sharps into bags for disposal. Do not pass sharps from hand to hand. More guidance can be obtained by logging on to www.hse.gov.uk/healthservices/needlesticks/. Further ways to manage and control infection. Immunization. It is recommended that service users in care homes or other residential facilities should have an annual flu immunization. Generally speaking, it's advisable for everyone over the age of 65, and especially from people suffering from a range of chronic conditions. Immunization is also recommended for people who are at increased risk from pneumococcal infection and hepatitis B. Isolation. Sometimes it is necessary to isolate a service user to prevent further cases of infection. In most situations, that will mean the individual will be cared for in their own room. The room should contain everything needed for good hand hygiene, including liquid soap and disposable towels. Diarrhea and vomiting. Diarrhea is not always caused by an infection. For example, it is sometimes caused by a change in diet, but can also be the result of a virus. It should be assumed that it is infectious until proved otherwise. If the service user is vomiting, he or she should be cared for in a single room. If staff become affected, they should be excluded from work until 48 hours after the symptoms have settled. A rigorous cleaning regime must be carried out to thoroughly clean the environment and equipment. Hand washing with liquid soap and water is vital. If you are a domiciliary care worker, liquid soap is not always available, so you should use a bar of soap, but ensure it is clean, or even better, new before you use it. Alcohol rub does not eliminate the viruses and bacteria that cause diarrhea. Environmental considerations. General cleaning. The environment in which you care for people must be clean. Where there is dirt, the risk of transmission of pathogenic microorganisms is great. The environment needs to be disinfected and sterilized as appropriate. Your workplace will have specific policies and procedures to be followed to keep the environment clean and fight infection. Cleaning and decontamination of reusable equipment. In a care setting, equipment, medical devices, and living areas are frequently decontaminated. This can be achieved in 3 ways according to the level of risk: cleaning, disinfection, sterilization. Risks are also divided into 3 categories: high, medium, and low. Cleaning removes some contamination but does not necessarily destroy microorganisms, some of which could be pathogenic. This method of decontamination is used for low-risk areas such as floors, furniture, and mobility aids. Disinfection significantly reduces the number of microorganisms but does not necessarily destroy all of them, such as some viruses and bacteria. This method is generally used for items which come into contact with intact mucous membrane, such as bedpans, urinals, and commodes. These would be considered medium risk. Sterilization destroys pathogenic microorganisms, including viruses and bacterial spores. This method of decontamination would be used for all items involved in invasive procedures, such as medical instruments which would penetrate the skin or enter the vascular system. These would be categorized as high risk. In order to determine the appropriate method of decontamination, a risk assessment should be carried out for all medical equipment. Service users should have their own soap, toothbrushes, razors, and toiletries. Also, face cloths and towels should not be shared. Color coding. A system of color coding of cleaning materials and equipment sets out to ensure that items are not used in multiple areas, which therefore reduces the risk of cross-infection. For example, cleaning equipment used in high-risk areas such as bathrooms and toilets should not be used in wards or kitchen facilities. Handout 3 shows the color coding system which is used in hospitals and recommended for care settings. Again, this is an unlikely scenario in domiciliary care, but the principle remains the same. For example, you would not use the same cleaning equipment in the bathroom and toilet that you would use in the kitchen. Managing spillages of blood or other body fluids. Blood and body fluids may contain microorganisms which must be made safe as soon as possible after the spillage has occurred. These spillages may expose the care worker to pathogenic organisms. There are spillage kits available to deal with biological waste, and care workers should be trained in how to use these. It is not essential to have a commercially available spillage kit, as long as gloves, aprons, a chlorine-releasing agent, paper towels and waste bags are easily accessible. In some situations, such as domiciliary care or supported living services, bags are not readily available. You must consult your manager or supervisor for advice. You must also follow standard precautions to protect yourself. Blood is effectively cleared up with the use of a chlorine-based disinfectant, which would be classed under the COSH, Control of Substances Hazardous to Health regulations, and which requires particular care in order to maintain safe practice. Materials used to clear up the spillage must be disposed of in the clinical waste system. Food handling. When handling food, you need to take proper precautions in order to keep food safe. If you do not follow strict guidelines, the food could be covered in bacteria, which could cause illness. Food poisoning can be dangerous and even fatal in vulnerable people. The most common bacteria are Salmonella, Campylobacter, and E. coli. High-risk foods include soft cheeses, sausage rolls, eggs, shellfish, cooked meat, pâtés, pies, stock and gravy, cream and ice cream, dairy products, and shellfish. Undercooked or raw food also poses a potential risk. You can reduce the risk of infection by following these guidelines. Using food which is fresh. Rotate stocks of food, keeping the older supply at the front of the cupboard or fridge. Keep to use-by dates. Follow cooking instructions on containers. Check and record the temperatures on the fridge and freezer. Do not refreeze food. Keep food covered. Make sure working surfaces are clean. Keep cooked and raw food separate in your fridge. Keep the environment clean, for example floors, shelves, cookers. Use colour-coded chopping boards. Thoroughly clean small equipment such as tin openers. Do not allow pets into kitchen areas. If you are working in a domiciliary setting, it is unlikely that the person you are looking after will have colour-coded chopping boards, although it's hoped they would have at least a couple, one for raw and one for fresh food. You can do much by encouraging the individual to follow some, if not all, of the guidelines above. You should check the temperatures on fridges and freezers and ensure that they are working properly. You should record that you have done this, and if there is any problem, you should again report this to your manager or supervisor. Soiled laundry management. Laundry can also be a source of infection, and therefore must be handled and managed carefully. Infection can be passed from one item to another, so correct procedures must be followed. Specific hygiene measures should be in place to reduce the risk of contamination. For example, personal protective equipment should be available. Laundry should be appropriately decontaminated. There should be a designated laundry area that is not used for any other purpose. Cleaned and soiled linen should be physically separated throughout the laundry process. Hand hygiene facilities should be available. Make sure you know the procedures in your work setting for dealing with different types of laundry. Again, this will be different in domiciliary care, and you should refer to your workplace policies and procedures. Disposal of waste. All clinical waste should be identified with a coded tie or label to indicate the source of the waste. Foot-operated bins should be provided for waste storage in bags. Handout 4 shows the approved colour coding of healthcare waste according to infection risk. Other general waste, for example food waste and packaging materials, should be disposed of in black refuse bags. The Hazardous Waste England and Wales Regulations 2005 do not allow mixing of waste. For example, this means domestic waste should not be put in the clinical waste system. This type of waste is usually collected by the local authority for final disposal. Many local councils have introduced recycling for domestic waste and provide the appropriate containers or wheelie bins for the job. If waste has to be stored before it is collected for final disposal, it should be stored in the designated safe place and not in places which are accessible to the general public. It should also be stored in a place which is easy to clean and disinfect. Storage should not be near areas where food is stored or prepared. There should be signs to alert and warn people that there are hazardous materials in the designated storage area. Activity. There is an activity attached to these notes which asks you to think of ways that you could help to improve the fight against infection in your day-to-day duties. Write these down and discuss these with your manager. Personal. Your own personal hygiene plays an important part in infection control. Pay particular attention to your nails. Make sure they are kept short and free from dirt. Your hair should be regularly washed, and if it is long, it should be tied back from your face so that it will not hang over a service user when you are caring for them. Personal jewellery should be removed, apart from a wedding ring. Your clothes should be regularly laundered and footwear kept clean. In summary, there is much you can do to prevent and control infection within your work setting. Always be aware of the possibility of cross-infection and take all necessary steps to prevent this happening. Follow your organization's policies and procedures at all times and report any potential hazards to your supervisor. You may now wish to complete the questionnaire.